we are supporting youth community to address HIV, human rights, and health-related issues via advocacy, community mobilization, and capacity building. We, like 40 young leaders from around the region, we sat together, identify what are the key issues that young MSM and transgender in the region are facing in terms of accessing to HIV interventions. And one of the very big thing came up is acceptance. Acceptance is not just only like acceptance from the family, from school, or from friends, but from even like from themselves too. 95% of new infections are now falling upon young key-affected populations, including young MSM and transgender. There is a critical need, an urgent need of like more intervention, more programs targeted like young people. And as a team, like a regional team, with together YVC and Youth Lead, we're together working on really hard on advocating for more resources, more attention to young key-affected populations, including young MSM and transgender. A lot of young people, they might either because they don't understand about their own sexuality, or they're afraid of being attached to HIV because they are gay or like transgender, or because they have been overcoming a lot of homophobic or transphobic bullying in school, and encounter like a lot of traumatizing experience in their childhood, or like when they're growing up, they don't accept themselves as being gay. So there are two ways of responding to this kind of negative thoughts about their sexuality. They either would like lock themselves up in a closet, never exposing to anyone, while still taking a lot of like risky sexual behaviors, or otherwise they won't take up a lot of like, how to say, self-destructive behaviors like drinking, like using substance abusing, or like sex work. And it, you know, like substance abusing or drinking, it will like decrease the likelihood of like their adapting safe sexual behaviors. I think that the acceptance from family and friends and even in school for young MSM and transgender is pretty much like the most important to them, because like when you're growing up, you're going to school, and then if you have like a good friends and supporting environment in school, of course you will feel good about yourself. The level of self-confidence and self-esteem raising up, meaning that you are more likely to be out there, you're more likely to join with your community, and you're likely to take up services, as well as like be a part of the movement for HIV for young people. As young people, we have been coming together a lot. We develop a lot of like documents, declarations, like call to actions, recommendations, like all type of advocacy paper. But then, to what level has all these paper have been translated into action, like reaction in country level and even like in local community level? It's still a very big question now. I think that there's something going on online, like during the era of high tech and online communication has its pros and cons. Why it provides like young people with like ready access to information, the right information, what I mean, regarding HIV/AIDS treatment, care, support, and even prevention. But otherwise, there's a lot of like type of opinions going around that young people might misunderstand it or misinterpret it into like their own perception. The availability and the coverage of treatment these days is being way better than in the past. Like people are getting access to treatment, and they staying healthy, and their life like being longer. It kind of calms like young people's nerves down over the issues of HIV. That's why sometimes they get oblivious a little bit about the situation. But then again, what we like together as a team, the regional team, has been doing is to raise more awareness, to get all the key messages through to young people, so they could be really aware that of their risk with HIV and other things. So I think that it's not what you that statement is not necessarily the fact, but then we've been trying really hard just to eliminate such misconception about HIV/AIDS among young people.